Now we're going to review the skin biopsy using a scalpel. There are many ways to biopsy the skin. Punch biopsies are nice, which I have an example of here because they make a nice round circular cut. But sometimes you have a lesion like this that won't fit in the diameter of the cutting area or cutting surface of the punch biopsy, and so you need to use either a dermablade or a scalpel. I personally like dermablades because I feel like you get a little bit more control, but other people prefer scalpels and they'll accomplish the same thing. So as far as supplies, I have my pig's foot here with a lesion that I've painted on it. I like to use pig's foot to practice because the skin turgor is similar to that of humans. Then I have my local anesthesia, and a lesion like this would take anywhere from about 0.2 to 0.3 cc's of lidocaine, 1 or 2% with epinephrine. We use epinephrine to keep the field free of blood as we are incising. Remember the rule of thumb when you are injecting lidocaine with epi, it shouldn't be used on any surface that's very superficial where there's less blood supply, so ears, nose, penis, or toes, because it could shut down those tiny capillaries and then cause some damage to the tissue. But this is an area that's well circulated, and so we can use it for this particular lesion. Then I have some betadine here and 3 swabs that I would clean off the surface before I begin the biopsy. I have my scalpel and my pickups to pick up the tissue sample, and then a couple of pairs of scissors I just have to show you. I like generally the smaller ones because if there's an edge that's kind of retained after I pick up the sample, I can just snip with those little scissors. These are thin though, so you could also use those, but either would do the trick. So what I generally do is in my non-sterile gloves, I will clean the site, and I'm not going to put the betadine on today because it will obscure what I want you to see, but I would normally clean with my 3 swabs, of course, from the inside, moving in concentric circles outside, and then I would inject, and then while I'm waiting for that to set up, that local, then I change into my sterile gloves. So I'm going to inject, and again, I would do this with my clean gloves, and then I would change to my sterile gloves, but for the sake of time, I'm just going to inject with my sterile gloves. Make the skin rather taut. We're going to start just outside the edge of the lesion, perpendicular, so we're barely underneath the dermis. And we want to create a wheal underneath the lesion. You see there that it's creating a nice wheal, and it will often blanch, telling you that the local has gotten out there. I'm going to let that sit up for just a moment. Sometimes you have to inject in spokes going around the lesion depending on the size of it. Now for this one, I'm going to hold the scalpel like so, and I'm just going to start just outside the boundaries of the lesion and gently back and forth, keeping the fingers of my other hand as far away as I can. I'm just going to try to get around it and come underneath it. This is where pickups can be handy. As I get that final last bit of tissue. There's our lesion. We're going to put that in formalin, and you can see that it leaves a nice shallow cut in the skin. If that were bleeding, we could put some Moncels or silver nitrate on it. Rarely does it need a stitch because it is fairly near the surface. And that is the way that you would do a biopsy using your scalpel.